Insulin resistance is one of the most common reasons blood sugar becomes harder to control over time, but most people don't really understand what it means or why it happens. In the next few minutes, I'll explain insulin resistance in a simple way, step by step, what it is, why it happens, what it can lead to, and what it doesn't mean. This video is for educational purposes only and is not medical advice. What insulin does. To understand insulin resistance, you first need to understand insulin. Insulin is a hormone made by the pancreas. Its main job is to help move glucose, also called blood sugar, out of the bloodstream and into the body cells. Your cells then use glucose as energy. After you eat, especially if the meal contains carbohydrates, glucose enters the bloodstream. That's normal. In response, the pancreas releases insulin. Insulin works like a key, helping glucose enter cells. So insulin is not bad. It's a normal part of how the body stays balanced. What insulin resistance means. Insulin resistance happens when the body's cells stop responding to insulin as effectively as they should. This means glucose doesn't move into the cells as smoothly. So the pancreas tries to help by releasing more insulin to get the job done. In simple terms, with normal insulin response, a small amount of insulin helps control blood sugar. With insulin resistance, the body needs more insulin to do the same job. At first, the body may still keep blood sugar in a normal range, but the effort behind the scenes is increasing. That's why insulin resistance can exist before someone ever notices symptoms. Simple example added. Think of insulin like someone knocking on a door. In a healthy response, the door opens quickly and glucose goes into the cell. With insulin resistance, the door doesn't open as easily, so the body knocks louder by releasing more insulin. The goal is still the same: get glucose into the cells so the body can use it for energy. Why insulin resistance can develop. Insulin resistance is not caused by one single thing. It often develops gradually, influenced by different factors, such as frequent spikes in blood sugar and insulin over time, high intake of ultra-processed foods and sugary drinks, low physical activity, poor sleep quality, long-term stress, genetics and family history, excess body fat, especially around the abdomen. One important thing to understand is this: insulin resistance is usually a long-term process, not something that happens overnight, and many people may have it mildly without realizing it. What can happen over time? When insulin resistance continues for a long time, the pancreas may struggle to keep up with producing extra insulin. This can lead to blood sugar staying higher more often. Over time, this may increase the risk of conditions such as pre-diabetes, type 2 diabetes, fatty liver changes, metabolic syndrome, heart and blood vessel problems. But it's important to stay calm and realistic. Having insulin resistance does not automatically mean you have diabetes. It means the body may be working harder to maintain balance. Simple signs people often ignore. Insulin resistance doesn't always have obvious signs, especially early on. But some people may notice things like feeling hungry again soon after eating, craving sugary foods more often, feeling tired after meals, weight gain around the belly area, difficulty losing weight despite effort. These signs are not proof of insulin resistance, but they can be useful reasons to have a health conversation with a professional. How insulin resistance is checked. Insulin resistance isn't something you can confirm just by guessing. A healthcare professional may use different tests depending on your situation. Some common checks include fasting blood glucose and HbA1c, and sometimes insulin-related markers. But the most important thing is not just one number, it's the overall pattern, your symptoms, your health history, and your results over time. If you're concerned, the best step is to speak to a qualified healthcare professional who can interpret your results correctly. Insulin resistance versus type 2 diabetes. It's also important to understand the difference between insulin resistance and diabetes. Insulin resistance means the body needs more insulin to control blood sugar properly. Type 2 diabetes usually happens when the body can no longer keep blood sugar stable over time. So insulin resistance can come earlier, but it doesn't mean diabetes is guaranteed. That's why learning how blood sugar and insulin work is helpful, because it supports better awareness and better decisions over time. Insulin resistance is a metabolic issue that develops over time, and it's mainly about how the body responds to insulin. Insulin is a normal hormone. Insulin resistance simply means the body needs more insulin to manage glucose effectively. Understanding how it works is a powerful first step. Understanding these basics also helps you avoid misinformation online, and it helps you ask better questions during checkups. If you want more simple health explanations like this, subscribe to Health Insight Lab. This video is educational only and does not replace medical advice. Always consult a qualified healthcare professional for personal guidance.